Hi, I'm Mikhaila Lazanyi and I'm an obstetrician and gynecologist and a paediatric and adolescent gynecologist. I'm part of the team at Melbourne Obstetric and Gynecology Specialists here at Epworth Freemasons Maternity. Pregnancy is a really exciting journey, and there are some things you can do prior to falling pregnant to improve the outcomes of your pregnancy. I recommend making an appointment to see your obstetrician, and we will review your medical history, ensure that we optimise any pre-existing conditions such as asthma, diabetes or mental health, and ensure that your medications are safe to continue during the pregnancy. It's a great time to review your vaccination status, and in particular making sure your immunity to chickenpox and measles, mumps and rubella is up to date, because this is unfortunately a vaccine that we don't recommend giving in the pregnancy. I recommend that you commence folic acid and iodine, because these can improve fetal brain development and reduce the risk of neural tube defects, and I recommend starting these at least 4 weeks before falling pregnant. It's a great time to enhance your lifestyle, so in particular aiming for exercise most days, improving and ensuring adequate sleep and reducing stress, and also stopping alcohol, smoking, vaping or other substances. But we'd really love to chat to you about what we can do in your case, so please reach out. It's a great time to review all of your medications before trying to fall pregnant, and this is to ensure that they're safe to continue during the pregnancy. This includes prescribed medications, over-the-counter medications, and any complementary medicines, vitamins, minerals or herbal supplements. In Australia, all medications are given a safety category for pregnancy and the breastfeeding period. So we will review your medications and make sure that they are safe to continue, and if they aren't, we will discuss the best options for you. Pregnancy and the prenatal period is usually an exciting journey, but it can be daunting, and lots of hurdles and/or hiccups can present along the way. Your mental well-being is so important, and we know that 1 in 10 birthing parents will experience perinatal anxiety and depression throughout the pregnancy or after the pregnancy, and it's not always possible to predict who this is going to impact. If you have a pre-existing mental health condition, I recommend you continue seeing your support team through the preconception and the pregnancy period. If you find you're developing symptoms of anxiety or depression, your first point of call, I recommend touching base with your obstetrician or your midwife. Your care team may also include a perinatal psychiatrist or a psychologist. There are some great online resources available, and these are both for information but also to access support. Some examples include PANDA, the Perinatal, Antenatal and Depression Association of Australia, and the Gidget Foundation. It is also important to remember that 24 hours a day, 7 days a week, you can reach out to Lifeline or Beyond Blue. We are here to support you through your pregnancy and the postpartum journey in both your physical and your mental well-being. And this acknowledges that sometimes it's a smooth journey and sometimes that there are challenges, but we will be here journeying with you along the way.